Phlebotomy is an essential skill in the healthcare industry, but even the most experienced professionals can make mistakes. These mistakes can affect patient safety, the accuracy of results, and your efficiency as a healthcare provider. In this video, we'll highlight the top 5 most common mistakes made during blood draws, and offer practical tips to avoid them. Whether you're just starting out or looking to sharpen your skills, this guide will help you become a more confident and precise phlebotomist. Let's dive into the first mistake. Mistake 1. Improper needle insertion. One of the most common errors in phlebotomy is improper needle insertion. This includes inserting the needle at the wrong angle, too shallow, or too deep into the vein. An incorrect insertion can cause pain, bruising, or even result in missing the vein entirely. To avoid this, always aim for a 15-30-degree angle when inserting the needle. Keep the bevel facing up and enter the vein in one smooth, steady motion. If the needle is too shallow, you might miss the vein, and if it's too deep, you could puncture through the vein. Practice and confidence are key to mastering this technique. If you do miss the vein on the first try, stay calm. Explain to the patient that you will need to try again and find a different site. Remember, a calm demeanor helps reassure your patient and keeps the situation under control. Mistake 2. Using the wrong needle or equipment. Another common mistake is choosing the wrong needle or equipment for the blood draw. For example, using a needle that's too large can cause unnecessary trauma to the vein, while using a needle that's too small can result in hemolysis, which can alter test results. To avoid this, always assess your patient before selecting your equipment. For most adult patients, a 21-gauge needle is appropriate. For patients with smaller or fragile veins, such as elderly individuals or children, a smaller gauge, such as a 23-gauge butterfly needle, may be more suitable. Remember, using the right needle minimizes discomfort and ensures better results. It's also important to check the condition of your equipment before each draw. Ensure that the tourniquet is functioning properly, the tubes are correctly labeled, and that everything is sterile and ready to go. In the next section, we'll continue with the third and fourth most common mistakes and how you can avoid them. Stay tuned as we go deeper into refining your phlebotomy technique. Let's move on to the third and fourth most common phlebotomy mistakes. These are crucial to avoid in order to ensure both patient safety and accurate test results. Mistake 3. Incorrect patient positioning. Proper patient positioning is essential for a successful and safe blood draw. One common mistake is performing the draw while the patient is in an awkward or uncomfortable position. This not only increases the patient's anxiety but also makes it harder for you to locate and access the vein. To avoid this, always make sure your patient is seated comfortably, with their arm fully extended and supported. Ideally, the arm should be at heart level or slightly lower, allowing for optimal blood flow. Encourage your patient to relax and avoid clenching their fist too tightly, as this can interfere with blood flow and lead to inaccurate results. For patients who feel faint or are prone to dizziness during blood draws, it's best to have them lying down. This not only prevents fainting but also ensures you have stable access to the vein. Remember, a comfortable patient is more likely to cooperate and remain calm throughout the procedure, making your job easier and more efficient. Mistake 4. Failing to label samples properly. One of the most critical, yet often overlooked, mistakes in phlebotomy is improper labeling of blood samples. Mislabeling or not labeling tubes immediately can lead to serious consequences, such as delayed diagnoses, incorrect treatments, and even legal implications. To avoid this mistake, always label each tube immediately after the blood draw, before you leave the patient's side. Double-check that the label includes the patient's full name, date of birth, and any other required identifiers. If your facility uses barcodes or electronic systems, make sure the information is properly scanned and recorded. In busy environments like hospitals or clinics, it's easy to get distracted and skip this step, but never leave it for later. A small labeling mistake can lead to significant errors in patient care. Now, let's move on to the final and perhaps most critical mistake that phlebotomists make. Mistake 5. Not prioritizing patient safety and comfort. One of the biggest mistakes you can make as a phlebotomist is not placing enough emphasis on patient safety and comfort. This can happen when you're in a rush, distracted, or simply too focused on the technical aspects of the blood draw. However, ensuring that your patient feels safe and comfortable is just as important as using the right techniques. To avoid this mistake, always prioritize the patient's experience. Start by explaining the procedure to them in clear, simple language. Let them know what to expect, and answer any questions they may have. A little reassurance can go a long way in easing their nerves. Pay attention to body language. If a patient seems anxious or uncomfortable, take a moment to talk to them and help them relax. Sometimes, a brief pause to adjust the patient's position or give them a moment to breathe can make all the difference. In terms of safety, always follow proper hygiene protocols. Wash your hands before and after each procedure, and wear gloves at all times. Disinfect the puncture site thoroughly before inserting the needle, and use sterile equipment for every draw. If at any point the patient expresses discomfort or pain, don't ignore it. Address their concerns and take appropriate steps to make the experience as smooth as possible. Patient trust is vital, and by prioritizing their comfort, you not only improve the blood draw but also enhance their overall healthcare experience. Now that we've covered the top 5 common mistakes in phlebotomy, let's quickly recap. Avoid improper needle insertion by mastering the correct angle and depth. Always use the right needle and equipment for each patient. Position your patient correctly to ensure a smooth procedure. Label your samples immediately and accurately. Prioritize patient safety and comfort throughout the entire process. By avoiding these mistakes, you'll not only become a more skilled and efficient phlebotomist, but you'll also provide better care for your patients. Now that we've covered the top 5 mistakes, let's dive deeper into a few more important tips that can enhance your practice as a phlebotomist. Tip 1. Handling difficult veins. Many phlebotomists face challenges when trying to access difficult veins, such as veins that are too small, deep, or prone to rolling. The key to overcoming this challenge is patience and preparation. First, warm the patient's arm by applying a warm compress or having the patient rub their arm briskly. This increases blood flow and makes the veins easier to find. Palpation is another critical skill here. Take your time to feel for the vein and assess its depth and stability before inserting the needle. If you encounter a rolling vein, anchor it by using your thumb to apply pressure just below the insertion site to stabilize the vein. Always be aware of the patient's comfort level. If you're having difficulty, don't hesitate to ask for help from a more experienced colleague. It's important to remember that confidence and patience are key when dealing with difficult veins. Tip 2. Preventing hematomas. A hematoma is a collection of blood outside of the vessel, which can occur when the needle punctures through the vein or is removed too quickly without applying proper pressure. To avoid hematomas, make sure you remove the needle smoothly and immediately apply firm pressure to the puncture site. Hold the pressure for at least 30 seconds or until the bleeding has stopped. Be especially cautious when drawing blood from patients who are on blood thinners or who have a history of bruising easily. In these cases, it may take longer for the bleeding to stop, and applying pressure for an extended period is crucial. Additionally, be sure to remove the tourniquet before removing the needle, as this will reduce the pressure in the veins and lower the risk of hematoma formation. Tip 3. Avoiding cross-contamination. Cross-contamination is a serious risk in any healthcare setting, especially in phlebotomy, where bloodborne pathogens can be transmitted if proper protocols aren't followed. Always change your gloves between patients and make sure to disinfect your hands thoroughly. Dispose of used needles immediately in a sharps container, and never recap a used needle. Recapping needles is a dangerous practice that can lead to accidental needle sticks, increasing the risk of infection for both you and the patient. When collecting multiple samples, use new, sterile collection tubes and needles for each draw, ensuring that no cross-contamination occurs between samples. Tip 4. Maintaining professionalism under pressure. In a busy clinic or hospital, the pressure to perform multiple blood draws quickly can be intense. However, rushing through the process often leads to mistakes such as missed veins, improper labeling, or insufficient communication with patients. To maintain professionalism under pressure, focus on staying calm and organized. Prepare your materials ahead of time, and double-check that everything is in place before you begin the blood draw. If you feel overwhelmed, take a deep breath and remind yourself to work methodically. Even when faced with a busy schedule, never sacrifice patient safety or comfort for the sake of speed. It's far better to take a little extra time to ensure that the procedure is done correctly than to make a costly mistake. Tip 5. Managing patient reactions. It's not uncommon for patients to feel anxious, dizzy, or even faint during a blood draw. Knowing how to manage these reactions is key to providing good patient care. First, always watch for signs that a patient may be feeling lightheaded or uncomfortable. These include sweating, pale skin, or unsteady breathing. If you notice any of these signs, stop the procedure immediately and assist the patient in sitting down or lying back if necessary. Encourage them to take slow, deep breaths, and provide reassurance that everything is under control. In cases where a patient does faint, ensure they are in a safe position and call for medical assistance if needed. Always remain calm and professional, as your response will help the patient feel more secure in what can be a frightening moment. That wraps up our video on the top 5 common phlebotomy mistakes and how to avoid them. We hope you found these tips helpful in refining your technique and improving your practice. If you enjoyed this video and want to see more content like this, don't forget to hit the subscribe button. We regularly post tutorials, tips, and educational videos to help you advance your healthcare career. And if you found this video valuable, be sure to give it a thumbs up and share it with your colleagues. Thanks for watching, and stay tuned for more insights into the world of phlebotomy and healthcare. Your continued growth as a professional begins with the small steps you take every day.